If your teen is struggling with chronic fatigue, brain fog, random twitches for their muscles, functional seizures, or non-epileptic seizures, mysterious nausea and vomiting, or stomach pain, you might be caught in this exhausting cycle of symptom whack-a-mole. That's what I would call it. You're constantly chasing the immediate trigger, trying to fix 10 different things all at the same time by seeing like 20 different doctors. But what if focusing so heavily on the surface symptoms is actually what is keeping your teen's nervous system stuck in survival mode? Today, we're going to react to another video of Stanford neuroscientist Dr. Andrew Huberman's deep dive into the brain-body communication to uncover the actual biology behind these somatic symptoms. We're going to specifically look at his video to break down these three things. Number one, why standard deep breathing exercises can actually backfire for nervous system regulation if done correctly. Number two, how a single negative event can train the brain into this vicious stuck loop of chronic nausea. And number three, Andrew Huberman's fascinating insight into sort of why a parent nervous system state is biologically contagious to their teen. So let's go. Hi everyone, my name is Dr. Lee. I am a pediatric health psychologist and the founder of Teen F&D Academy coaching program, where I help teens with functional neurological disorder and their parents finally get their life back. In my practice, I see so many well-meaning families fall into this trap of, I would call it, rowing a boat with one arm, meaning doing all the right physical strategies, but with the hyper-vigilant mindset that accidentally spins the wheels, and they are all feeling frustrated because they're not going anywhere. Now, true F&D and somatic recovery is not about playing a whack-a-mole with symptoms on the surface. It is really about helping your teen build a predictable, safe relationship between their brain and body, also known as brain training, while teaching you as a parent how to regulate your own state so that you can confidently back off without abandoning them. So let's dive into Dr. Huberman's video and look at the science. So first, we're going to look into how Dr. Huberman is kind of defining the brain-body communication and what part of the body and brain are actually related and connected.
We have a system in our body that connects our brain to all of our bodily organs and connects all of those bodily organs to our brain. And that communication between brain and body in both directions creates a situation where either we are positioned to do things well or we are positioned to do things poorly. So I really want to dive in and dissect what is this system of brain-body communication? What does it look like? What are the actual neurons and connections? The system that's most often associated with this is our 10th cranial nerve called the vagus nerve. The word vagus relates to the word vagabond, which is to wander. And indeed, the vagus nerve is a vast, enormous wandering set of nerves. So it's not one nerve. It's not like one fiber, one axon, as we say. So where do they go? Well, they leave the brain and the brain stem. The brain stem is kind of the back of your brain. If you touch the back of your neck, it's about 3 inches deep to where.
Just so you know, he goes really deep diving into the biology, anatomy, and all of the others. So I am just going to dissect the pieces that are super relevant and then break it down to simple, easy to understand pieces of information, okay?
To where you're touching. The neurons that are there send information into the body to control your bodily organs. How fast your heart is beating, how fast you're breathing, how fast your digestion is occurring. Even things like whether or not you are going to secrete so-called killer cells, your immune cells, from your spleen to go ward off bacteria. Now, the neurons there don't know what to do unless they receive information about what's going on within the body. So everything from your intestines to your stomach, etc., and your spleen are sending information also up to the brain. There are two fundamental features of what's going on in your body that need to be communicated to your brain, these neurons in your brainstem, in order for your brain and your body to work together correctly. And the two types of information are mechanical information and chemical information. So when you think about your sense of self and your ability to understand what's going on in your body, if you feel good or if you feel bad.
So there's a lot of information there, but basically this is just to show, hey, If you're still thinking that brain and body or mind and body are completely different things, this really proves they're all connected. Like my head and brain are connected to my body, as you can see. And this is really to show that we can no longer rely on this outdated intel about all the physical symptoms has to be either purely physical or brain, emotional, mind thing. Guess what? They're all connected. Every single thing that you're experiencing is a combination of brain and the body symptoms and communication and all of the above. So now I'm going to move on to a little bit about the body parts where he goes into super details, starting with breathing.
Like little tiny balloons throughout our lungs, those little bags of air can fill up or they can deflate, right? Just like your lungs overall can fill up or they can deflate. The diaphragm is a muscle and it sits below our lungs. And the way the diaphragm and the lungs work together is very interesting. The diaphragm is actually skeletal muscle, so it's just like a bicep or a quadricep. And the fact that it is skeletal muscle is important because it has a unique property, which is that you can control it voluntarily. How the diaphragm moves up and down determines how you breathe. How you breathe is also dependent on little muscles that are between your ribs, the intercostals and other muscles. When we inhale...
Okay, so really quick, whenever I talk about slow breathing and belly breathing, some people can get confused about belly breathing versus diaphragmatic breathing. Well, it depends on who you ask. In my practice, basically, because I work with kids, it's easier for me to say, yeah, let's focus on the belly, but really mechanically and anatomically speaking, we're talking about diaphragmatic breathing.
These little sacs in our lungs fill up and our lungs expand. And when we do that, we take up space in our thoracic cavity and our diaphragm moves down. When we exhale, the diaphragm moves up, the lungs get smaller. Okay. This actually controls our heart rate, and it works in the following way. Our heart actually has a little more space because the diaphragms move down. So the heart gets a little bit bigger, physically bigger, not in the emotional sense, but physically bigger. And as a consequence, whatever blood is in the heart flows at a slower rate because it's a larger volume. So bigger volume heart, same amount of blood inside the heart means slower flow. The brain registers that because there are a set of neurons on the heart called the sinoatrial node. That information is registered by the brain, and the brain sends a message back to the heart to speed the heart up. So if you do long inhales or you inhale more vigorously, you actually are speeding your heart up.
AKA increasing the sympathetic nervous system, which increases the heart rate. And therefore, another sign of brain body are connected and communicating with each other like a team.
Of course, you have to exhale as well. But for instance, if I were to inhale very long, like the entire time my heart rate is increasing, and then if I did a quick exhale, something else will happen. But if I kept doing that, my heart rate would increase.
Okay, so let me pause it here and talk about why deep breathing may not be helpful. Whenever you're feeling nervous or anxious or stressed, what do other people tell you to do? Either, don't worry, just relax, breathe, deep breathing, probably all of the above and then some. So when you're actually doing the deep breathing, our brain is usually thinking like deep inhalation. And I don't know about you, but if you keep doing that, you might be feeling, well, at least you might be also feeling, oh my gosh, I just don't feel good. I feel like more nervous and more anxious. And now I am feeling dizzy and I can't think straight and I feel like I'm just going to pass out. Guess what? You are actually hyperventilating by over breathing. Inhalation. So that is why deep breathing usually does not help for many people, especially for teens who are already on this high alert level of their brain and body communication. They're on this like hypervigilant state, which is usually the high level of fight or flight. So yes, you as a parent coming from a good place and well-meaning, just relax, do the deep breathing. If they can do it once or twice and feeling good, sure, keep doing that. Usually though, teens don't feel good because they tell me it just doesn't help. So instead of deep breathing, I will say, let's just slow down the breathing, focusing on the exhalation. So that's where you can prevent yourself from having this hyperventilation, overbreathing experience.
Going to increase linearly and forever, but it will increase with each inhale. Or I can simply make my inhales more vigorous and my heart rate will speed up. This is an autonomic and automatic relationship between the diaphragm, the lungs, the brain, and the heart. Now, if inhales speed the heart up, what happens on exhales? When we exhale, the diaphragm moves up. The heart has less space, meaning it gets a little bit smaller, which means that whatever volume of blood is inside the heart moves faster through that smaller volume. That information is sent to the brain via these collection of neurons called the sinoatrial node. The brain then sends information via the vagus nerve back to the heart to slow the heart down. So while inhales speed up the heart, exhales slow the heart down. And you can leverage this in a very powerful way to set.
Therefore, if other people tell you to do the deep breathing because they don't know any better, right? But they just want to help, then you can also interpret that as, okay, if you tell me deep breathing, that means I am just going to slow down my breathing and focus on breathing out instead of like breathing in vigorously, according to Andrew Huberman. Okay, so if you can't control other people, this is what you can do to control yourself based on the input you get from the outside world. Now, I'm gonna jump right into nausea, vomiting part because he goes really deep into this video. And of course, I'm going to share this video link in my description box below so you can actually see the original video, but I'm just going to pick and choose what would be relevant for your needs, okay?
Sensing the self would be sensing your own blood, but you do. There's a little area of your brain that's little indeed, but is very, very important called area postrema, Postrema. An area postrema is an area of the brainstem that sits right next to another brain area called the chemoreceptor trigger zone. And when the contents in your bloodstream are of a particular kind, meaning when there are pathogens or it's too acidic, the neurons in area postrema and the neurons in the chemoreceptor trigger zone trigger a bunch of motor reflexes in the abdominal wall that make you barf, okay? The feeling that you need to throw up is triggered by these neurons in the brainstem, and those neurons in the brainstem are triggered by the presence of certain chemicals. And the reason why you don't have any blood-brain barrier at that location is because postrema has to be there like a crossing guard, making sure that everything that's coming through the blood is okay. And if it even senses just the tiniest bit that things are off, it's going to trigger that reflex.
So I'm just going to stop it really quick and plug in. When he's talking about blood-brain barrier, it's called a BBB. And essentially it is like a wall in your head to block any like foreign things and then basically bad guys to come into the brain, because by all means, brain needs to be protected and the brain also needs to protect the body. So they are constantly in communication with each other. So he's basically talking about there are certain areas around it that is watching it like a hawk. It's almost like the bouncer at the club, you know, like certain people can come in versus not, and they are sort of like watching and then filtering who can come versus not when it comes to maintaining the health, aka you continue to live.
Some people, the memory of or the thought of something like blood or vomit, or use your imagination, can actually trigger the vomit reflex. And that's because these neurons in area postrema are very sensitive to prior experience of interactions with negative things.
Okay, so thank you so much, Dr. Huberman. Basically, this is exactly what I'm talking about. Brain is constantly scanning for potential threat based on clues like memory, thinking, feeling, and attention. So this is exactly what he is talking about. And the thing about this is, I mean, it makes sense, common sense, right? If you experience something negative, like bigger something, right? It doesn't have to be like a traumatic event, but like, ew, I didn't like it. Any of that, like feeling nauseous and vomiting, then your brain and body quickly learns, uh-oh, that was not bad. So let's put it in a memo and make sure that anything and everything that is remotely close to that potential threat, we're going to attack it. We're going to react it as if that thing is already happening so that our brain and body are kept safe. And therefore, this is where the solution isn't necessarily avoidance, even though it makes sense. Like parents having experience or witnessing their child having experience of having these symptoms, let's just say in school, and you can tell that your child is having a hard time in school, even though they may or may not like going to school, but you're thinking, oh my gosh, school is a trigger. Therefore, we need to pull our child away from the school so that the thing isn't going to happen, whatever the somatic symptoms. Guess what? That literally tells the brain to confirm, yeah, the thing that you avoided was actually really bad. Therefore, every time we think about the thing, aka school in this scenario, then your child is going to have an episode or the symptoms. And that is part of the reasons why your kid is completely fine on weekends, summertime, vacation, and then Sunday night or Monday or the school starts, bam, symptoms start to happen. And you might be wondering, is my child making things up, like faking for attention, like she doesn't want to go to school or what? Well, that's not really what is happening. It is essentially the brain body communicating with each other and get locked in on this hyper alert, hyper vigilance mode. Therefore, it doesn't have to have the thing present, aka just thinking about it, knowing memory can also triggers. Therefore, the avoidance isn't really the solution. Now, I'm going to move on to the vagus nerve and the motor communication system and feelings. So let's see what he has to say.
Which is the vagus nerve. We talked about vagus a little bit earlier, but the vagus nerve, this vagabonding, wandering nerve, is involved in everything I've talked about up until now. And the reason I saved it till now, rather than mentioning it all along, is to highlight a specific point, which is that whenever we hear about the vagus in popular culture, it's like the vagus calms you down, it'll mellow you out. Actually, most of the time, the vagus is stimulatory. When you ingest foods with amino acids, sugars, or fatty acids, the vagus nerve gets activated and triggers the release of dopamine and makes you more alert and go seek more of those foods, or what led to those conditions. When you feel nauseous, it's rarely calming. When you feel like you have a fever, it's rarely calming. So you're starting to get the picture that even though the vagus nerve is in the parasympathetic branch of the autonomic nervous system, it's not a calming system. It's a communication system, and it's a motor system. It communicates brain to body and body to brain, and it changes the function of different organs. Now, one thing that's important to highlight is that stress itself will alter the chemistry of your gut because of the ways that it shuts down the vagus nerve and quiets the neurons that communicate from gut to brain. I want to say that again. Stress will disrupt your gut and make you feel not good, poor digestion, and just lousy because of the way that it shuts down the vagus nerve and the neurons of your gut. It doesn't mess up your gut. It just doesn't let your gut get the signals up to your brain. And it also then throws off the chemistry, and then there's a whole cascade of effects.
Okay, so I want to plug in here because this is where I see a lot of miscommunication can happen between doctors / medical healthcare providers and the patients and or you guys. When, let's just say your child is experiencing mysterious somatic symptoms, whether it's a chronic pain, fatigue, brain fog, non-epileptic seizures, FND, all of the above. And then you're getting this diagnosis. Your child has a chronic fatigue syndrome, or not even a diagnosis. We know you don't have this. We know you don't have brain tumor. We know you don't have this physiological structural damage, and therefore it must be stress. So on one hand, I totally understand that this is a very dismissive / kind of medical gaslighting statement, which doesn't help because it doesn't provide any solution for you. However, it is also true that, again, the brain and body are connected, right? And they're communicating with each other all the time. So the stress, whether it's a physical stress, like, you're doing a rigorous exercise, that is also considered a physical stress, right? Or emotional, mental, other stress, social stress, like I'm about to go to this giant conference, and while I'm excited, I'm also feeling nervous, like I'm nervous-sided, because I know I am going to be super overstimulated, and that is going to make me feel very drained and tired. So just thinking about it, I'm like, that could it be also a sign of stress? Maybe, because it alters the thought and then the feeling and that physiological experience of quote unquote stress changes the gut and brain and all the chemical information and mechanical information. And again, he kind of went into super deep into like a gut-brain communication and all of the above. So I want you to check that out. But it's really interesting to hear and wanted to plug in that just because somebody is saying stress doesn't necessarily mean that means it's all in my head, right? That means I am making things up? Of course not. I mean, you could if you want to make things up of all these struggles you're having, but I know that is not what's happening. So I encourage you to, when you hear somebody says, oh, it's stress, instead of immediately reacting to what, that, I want you to kind of stop and think, not really agreeing what they're saying, but now that I know the stress changes the body chemicals, and I also know it's not my fault, and I also know this is not all in my head. I mean, brain is in your head. That's about it, right? And I know I'm not making things up. So all of these things don't need to be going together. So that is the empowerment you can have right now, today.
The vagus nerve, however, is responsible for emotion. And the way it does that is to pool, to aggregate the conditions of your gut, the conditions of your heart, and the conditions of your breathing, which includes your diaphragm and lungs, and takes that kind of as a collection of information and sends it to the brain and controls what we call your emotions.
Okay, I had to pause it here because this is what I mean by the body is sort of like keeping the score. Right? Body is accumulating all of these experiences. And therefore, how does it work? If you are so focusing on immediate trigger, like identifying immediate trigger, like tell me what you're feeling right before, right? And in my program, it's called FND sequencing. Like right before the event or episode or flare-up happened, what were you feeling like, not like emotionally, but like how were you feeling? What was happening in your body? So this is part of like a self-awareness exercise to increase that awareness, and therefore you're increasing this ability of what is called interoception, which he's going to talk about in a bit. But at the same time, when you're just focusing on those immediate triggers, then you fall into this trap of symptom chasing behavior. And therefore it kind of goes back to, oh, this thing was stressful, therefore we should avoid that, that, right? Or, well, my child is doing better. It used to be 10 symptoms and now onto 3 symptoms, which is great. And I'm happy for you. And now we're like really focusing on these 3 symptoms that happens every other week, and we cannot shake this off and all of the above. Well, I will tell you that yes, getting better from all those somatic symptoms are a great thing. There's no doubt about it. But if that's the only thing you're focusing on, then you're kind of missing the mark, because you're then not necessarily focusing on potentially that brain-body miscommunication part, which is much further deep into it. So the analogy I use is think of like each symptom as like a tree branch. Let's say it's like a fatigue and chronic pain, right? And then brain fog and sleep problem and whatever, FND symptoms, right? Muscle twitches and all of the above. You're so focusing on those branches and climbing up the tree to fix each and every symptom, each and every branch by duct taping this one and pressure washing this one, and then doing this like a special chemical on that one, right? While you're not really even looking at what's happening at the root, right? What's happening with the soil? Are they getting enough water and sun? Because if these things, the foundation is not there, no matter how many times that you're climbing up the tree, trying to fix each and every branch that is not doing well, that is not really where to go. And this is how you can get kind of stuck in this vicious loop. And in the meantime, your child is continuously getting not great, right? Like it's just, I'm so tired, super exhausting. And it is exhausting for you as well. Again, kind of thinking about what's the big picture, like what is the foundation of the brain-body communication, which is what I talk about in my program, Teen FN Academy, all the time. That's exactly where we start. So it's not just about, can we just focus on this one special technique to get rid of this one specific symptom? Again, okay, you're kind of missing the mark. You need to zoom out and then focus on the big picture and tree. All right, now, let's keep going with this vagus nerve topic. And it was really fascinating for me to hear what he had to say, especially around vagus nerve and emotion. So let's jump in.
Smiling relative to other periods of time. That is all an aggregate of, or a reflection rather, of your gut, your heart, and your breathing and the chemistry of your body. And what's remarkable, and this is where interoception really takes a leap into the incredible, is that there are beautiful studies that show that, for instance, when we know somebody...
Hold on, I might have skipped this, but basically he's saying where that vagus nerve accumulation body and intel shows up is the facial expression. That's what he was talking about. And then this was like super fascinating part. Okay, let's hear what he has to say.
Pretty well, and they are going through some sort of experience of any kind. Our heart rate actually starts to mimic their heart rate. Our breathing starts to mimic their breathing, even if we aren't conscious of their breathing. Somehow, human beings are able to register the internal state of other beings, and I think probably for animals too, but certainly for other humans, even at a distance.
Thank you, Dr. Huberman, for saying that. This is exactly what you, if you're a parent of a child who's struggling with this condition, your nervous system gets rattled when you're seeing your child is struggling. Only because you care deeply about your child's wellness and health and all the well-being, right? And it also backfires the teen's nervous system. So it's like a ping pong, right? So your child is struggling, right? And then you're like on this dysregulated mode as a result, and rightfully so. And then because of that, even though you're not saying anything on the surface, they can kind of feel it and they can smell it, right? Because if I have to guesstimate, your child is probably pretty bright and can see it. Then that also impacts your child's nervous system. So this is where in my program, Teen FN Academy, I require parents to be part of the program. Why? Because parents are the biggest influencer on the planet in a good way when they can actually learn what to do, what not to do, to create the environment where your teen, well, their team can build this predictable, safe relationship, aka brain-body retraining, so they can communicate with each other in a good way, in a healthy way again, and you as a parent is a vital part of it. So my program is not just about, well, it doesn't matter what I do, I don't care about myself, I just want my child to get better. Well, guess what? You are in it together. So if that is what you want, I just don't know what to do as a parent, I really want to help my child and I feel helpless, then you can also feel empowered to learn what is it that you're dealing with and your child is dealing with, and more importantly, what are you supposed to be doing and what not to do. And that is exactly how I built my program, and he is basically confirming, yes, this is a thing. So now he's talking a little bit about the what to do, right? Interoception is a sense of yourself, what's happening inside of them. In my program, I teach teens and parents too, but teens to build resilience. It's called the building resilience and improving neurohealth, called the brain, and building resilience while they're also increasing the self-awareness. This is precisely to increase the interoception skills.
Your sense of your internal landscape is linked to others. Now, you can enhance this interoceptive capacity for how you feel and how others feel. In other words, you can start getting a better readout of your internal state by doing a simple exercise, what is really a tool, and that is to learn to sense your heartbeats. And I think this is one of the reasons why meditation is powerful. When you stop taking in exteroceptive information from the outside world, by closing your eyes and focusing inward, as they say, you start paying attention to your breathing cadence. You start directing your mind's attention to your heart rate. And if you can start to perceive your heart beating, you actually are very quickly strengthen the vagal connections between the body and the brain. And so there's no real practice here. There's no breathe this way or do this thing, except to direct your awareness toward your heartbeat.
Okay. So a little bit of plug-in here. 99.9% of the teens that I work with, they don't like mindfulness, meditation, stuff like that, because it's just hard for them to get the grasp of the concept, let alone the experience, especially the ones that I work with who have these somatic symptoms like FND and chronic pain. Why? because they are having a hard time getting this interoception, like the sense of self, what's happening inside of them. So to them, it seems very foreign of the concept. That's why parents, if you're like, oh my gosh, meditation, great, let's do, Johnny, we have to practice this together. It might work for you. That doesn't necessarily mean it would resonate with your team. What does that mean? No, you don't have to give up. You practice the meditation, whatever it is that works for you, to become more aware of your own interoception, because parents also get rattled, when their child is struggling, right, physically. What I teach in my program is just pause and regulate. And remember, it's a skill that you also have to practice and get better. And for teens, it can be just about anything. It could be just slowing down the breathing. And I also recommend, if you don't feel like it, just blow bubbles, hum, sing, because they're spending more time breathing out, aka slowing down the heart rate, remember? And they are becoming a little bit more feeling quote unquote relaxed and calm and chill. So that is exactly what they can do. That is so easy to start getting the awareness of the interoception. Now, you might be also wondering, you know what? We have been doing all of those things and it's not working. Well then, I have one thing for you to think about, which I talked about kind of in the beginning, the rowing a boat with one arm or two arms. What does that mean? You can be doing all the right things, like a breathing exercise, body scan, relaxation strategies, and all of the above. Great. These are all great things. I want you to also pay attention to what's happening in your mind. What are you saying? What are you telling yourself? Like while you're practicing all the strategies, if you're saying to yourself, this is so stupid, this is not working, been there, done that, when am I gonna get better? This is so frustrating. I am doing all these things. Well, guess what? All of those mindset are natural reactions to what's happening that is so difficult to control. And at the same time, guess what? On one hand, this is the one that is trying to lower the heart rate. This is like accelerating the heart rate. So they're kind of canceling with each other. Therefore, the result is been there, done that. It doesn't work. Does that mean that it is their fault? Not at all. If you're never told and taught, hey, when you row a boat, you're supposed to be rowing a boat with two arms. If nobody's actually teaching you that, how are you supposed to know when there is nothing and then you're just like, oh, there's only one. I can do this. I can do this, right? I'm working really hard, and it just keeps spinning. And that is exactly what a lot of families fall into, this trap of the island, where they get stuck and they feel defeated and frustrated and discouraged. So you don't have to be on that island if you don't want to. And how to get out of the island? Starting with understanding your somatic symptoms. Again, if this is medically unexplained or something like FND or chronic pain, then really having understanding, oh, this is a combination of biological, psychological, and social stuff. It's not about stress, anxiety, or I'm making things up all in my head. It's none of that. And recovery is not really about symptom chasing whack-a-mole thing anymore. So if you're finding yourself exhausted by checking the symptom and going to different doctor for each and every symptom, or having 20 different medications, for each and different symptom, pause and think, okay, probably we're in this whack-a-mole. That awareness is a start. And then start focusing on building resilience equals predictable and a safe relationship between the brain and the body, aka retraining the brain and the body. If you need professional expert guidance of how to do that and how to get off the island, and if you want to work with me or want my help, then you can absolutely check out my website, teenfnacademy.com. Link is down below, and see if you're a good fit. Otherwise, leave me a comment below. What kind of symptoms are you experiencing, and what have you been doing, and what resonated with this video? I would love to hear from you, so that helps me to make something that is more meaningful and valuable for you. Now, thank you so much for watching this video, and I will see you in the next video.